We're here today talking with James, who's been a rapid disclusion time patient of ours. We saw James for the first time about 3 weeks ago.
Correct.
James, can you tell us a little bit about your headache history, your migraine history, when it started?
I don't remember when it started. It happened so long ago. But
20
my entire
years,
life,
50 years?
at least.
Yeah.
I just don't remember since I've had them for so long.
What kind of doctors had you seen to try to get rid of your headaches?
I've seen neurologists, basically I guess neurologists, my family doctors. They did tests on me and said that I was just unlucky, unfortunate, or I would outgrow it eventually.
What did they do to try to help you get through it?
They put me on antidepressants, tryptolene, Zomig, anti-seizure medicines, blood pressure medicines.
The typical, yeah, go ahead.
And I ended up sticking with Imitrex whenever I'd have a migraine. I had the injections. I'd pop myself injections.
You tried Topomax too?
It's just horrible emotional roller coaster rides, just bad feelings. Didn't like it.
How often were you having headaches?
At least 5
migraines?
days a week.
At least
Well,
5
migraines were about 3 a week at least, but a headache at least 5 to 7 days a week. Wow.
And intensity level, what would you, on a scale of 1 to 10, how intense were your headaches?
My migraines, I would throw up, give myself a shot,
Yeah.
and then lay in bed.
How did it affect your life?
Everything I did in my life revolved around my headaches. If I want to take a trip somewhere, it was, okay, what am I going to do about my headaches when I'm on this trip? And it controlled my life.
And so 3 weeks ago you came into our office and we did our preliminary diagnosis of you, and we decided you'd be a good candidate for what we call rapid disclusion time therapy, which we said Dr. Kirstein from Tufts University came in, one of the 4 people that he's trained for this. How quickly did you notice some improvement after leaving our office after that first visit?
Well, I didn't have a headache that day. Well, my face kind of ached because the whole bite was changed, which was you said would happen. But after that, I did some things that I normally do that caused me to have headaches, and I went 2 days without them. And then next thing you know, the next day, and then a week, and here I am 3 weeks later, and I haven't had to take Imitrex not one time.
3 weeks.
In 3 weeks, which has never happened to me.
So, as you look into the future now, how do you think your life's going to change?
Oh, unbelievable. I couldn't do anything. I couldn't exercise, couldn't do anything. So, I'm going to get a mountain bike. I'm going to ride.
Excellent. Would you recommend Austin Migraine Relief to anybody out there?
Absolutely. If you have migraines, you need to come here.
Thank you very much. Appreciate it.
Thank you.
Excellent.